if I do need to take an antibiotic, are there specific ways to take an antibiotic? I know the question is, sometimes if I take just a few days and feel better, is that better to just quit taking it at that point, or should I take the whole thing?
You definitely want to take the complete course of your antibiotic. If a physician has prescribed you to take 7 days, 10 days, 14 days, whatever is prescribed, he is basing that course of therapy based off of guidelines and the information that's available that we have as medical professionals. And so you want to complete that course. If you finish it early, you decide to take 3 of the 10 days just because you're feeling better, there may still be some organisms that have not been killed off, and there's potential for those to become resistant. There is that potential, and so you do want to complete a course to make sure you completely kill all those organisms that you have.
Okay, thank you.
I'd
Dr.
also
Guinn.
add that another important thing is try to take the antibiotics as best you can according to the dosing instructions that we give you also. If we tell you to take it 3 times a day or every 8 hours, then try to stick to taking it every 8 hours, because a lot of times we don't think of this as in this light, that if you don't take it as we prescribe, that even if you miss a dose, then that antibiotic is not getting to the bacteria, not killing the bacteria as well as we'd like it to, and even that can lead to bacterial antibiotic resistance.
Our pharmacists do a great job at our local drugstores reminding us and giving us instructions on how to take our antibiotics. Some antibiotics are better absorbed when they're taken with food. Some are better absorbed when they're taken on an empty stomach. And there are also certain foodstuffs to avoid with certain antibiotics that may interfere with their absorption. And there's also certain timing with other medications. So read your instructions that your pharmacist gives you, and be sure and take them as directed. Complete your course of therapy, and follow up if you don't get better. Don't be taking antibiotics that have been in your drug cabinet for a number of years, because those antibiotics have a tendency to deteriorate. That does predispose to an incomplete treatment, and also may predispose to a resistant infection developing in either you or one of your family members.